Common medical terms. Let's start. Abdominal paracentesis. Removal of fluid from the peritoneal cavity. Abduction. Movement of a body part away from the midline of the body. Abrasion. Scraping away of a structure, such as the skin or teeth. Abscess. A localized collection of pus and disintegrating body cells. Absorption. The process by which a drug passes into the bloodstream. Acapnia. A decreased level of carbon dioxide in the blood. Acidosis. A condition that occurs with increases in blood carbonic acid or with decreases in blood bicarbonate, arterial blood pH below 7.35. Acromion. The lateral projection of the scapula extending over the shoulder joint. Active exercise. Exercise carried out by the client, who supplies the energy to move the body parts. Adduction. Movement of a body part toward the midline of the body. Adventitious breath sounds. Abnormal breath sounds. Albuminuria. The presence of albumin in the urine. Aldosterone. A hormone produced by the adrenal cortex that regulates the level of sodium in the body. Alkalosis. A condition that occurs with increases in blood bicarbonate or decreases in blood carbonic acid, arterial blood pH above 7.45. Alopecia. Abnormal loss of hair. Ampule. A small, sealed glass flask, usually designed to hold a single dose of medication. Analgesic. A medication used to decrease pain. Anaphylaxis. A severe allergic reaction. Anasarca. Generalized edema throughout the body. Anemia. A condition in which the blood is deficient in red blood cells or hemoglobin. Anesthesia. Loss of sensation or feeling, induced loss of the sense of pain. Aneurysm. Dilation of the wall of an artery or vein. Angiograph. A diagnostic procedure allowing X-ray visualization of the vascular system after injection of a radiopaque dye. Anorexia. Lack of appetite. Decubitus ulcer. An ulcer of the skin and underlying tissues produced by prolonged pressure, also known as pressure sore. Defecation. Expulsion of feces from the rectum and anus. Dehiscence. A splitting open or rupture. Dehydration. Insufficient fluid in the body. Dementia. Decline in memory and other cognitive abilities. Dependent edema. Edema that collects in the lower parts of the body, where hydrostatic pressure is greatest. Dermatitis. Inflammation of the skin. Dermis, corium. True skin, containing blood vessels, nerves, hair follicles, and glands. Detrusor. Muscle. The three layers of smooth muscle that make up the urinary bladder. Diagnosis. A statement or conclusion concerning the nature of some phenomenon. Diaphoresis. Profuse sweating. Diaphragmatic, abdominal. Breathing that chiefly involves movement of the diaphragm and the abdomen. Diarrhea. Defecation of liquid feces and increased frequency of defecation. Diastole. The period when the ventricles of the heart are relaxed. Diastolic pressure. The pressure of the blood against the arterial walls when the ventricles of the heart are at rest. Digital. Performed with the finger. Disorientation. A state of mental confusion, loss of orientation, time, place and person. Distal. Farthest from the point of reference. Distension, abdominal. See tympanites. Diuretic. An agent that increases the production of urine. Dorsal flexion. Movement of the ankle so that the toes point up. Dorsalis pedis pulse. A pulse located on the instep of the foot. Dorsal recumbent position. A backlying position with the head and shoulders slightly elevated. Demineralization. Excessive loss of minerals or inorganic salts. Thanks for watching. Like, share, subscribe and comment your valuable feedback.